So I'm an American that does not have health insurance, which can feel kind of scary at times, honestly, but I just want to break down some of the costs associated with like my healthcare and what I just experienced in Canada. All right. So in America, I have to go to see a specialist every single month and a primary care doctor every month because they prescribe one medication I've been taking for years. The specialist is $225 for an appointment every single month. They have to confirm my diagnosis. The primary care doctor is the one who writes the prescription for me every single month. That is $150. I believe both of those, their prices are going up soon. The primary care doctor sends the medication over to a pharmacy. Usually that pharmacy doesn't have it. And then I have to call 13 pharmacies and figure out which one has it and then go to that pharmacy and pay $600 out of pocket after a GoodRx discount. GoodRx is like a thing that you can pay like GoodRx Gold for, right? $600 out of pocket every single month, plus the fees for the specialist and the primary care doctor. And I've been taking this medication for years, right? I just had an experience where I know in Canada, like you all have a flawed healthcare system in a lot of ways. Like you can wait 24 hours to be seen at the ER. You may wait for years or months to be seen by certain specialists. I get it. You don't have it great here, but you do have it pretty good. What I had to do to get my medication here was I did a virtual appointment. It was $120 Canadian out of pocket. I showed them my health records. I showed them my most recent prescription. They sent over 3 months worth of prescriptions to a pharmacy, and that pharmacy called me and let me know that they had it in stock and that they were filling it up for me. $120 for the doctor's visit, and it was $120 Canadian for my medication, $117 Canadian for my medication for this month. And I don't have to worry about going to see a specialist and primary care doctor for 3 months now. That's almost $1,000 that I am not spending in America on my healthcare a month. I don't want people to come up to Canada to take advantage of this, but I'm just explaining, like, I don't understand why it's so flawed.
I've said it before, but I'll say it again. I am so lucky to live in Canada, and I am so lucky to have chosen Canada as my second home. But every now and then I get reminded of a few cons of living here, and I become eternally grateful that I also have my French citizenship. Let's talk about it. The number one thing that stands out to me is healthcare. Now, I understand that relative to other countries, Canada's healthcare is decent, it's accessible, it's universal. And compared to our southern neighbors, we can't complain. I also think that some provinces struggle more than others. I live in Ontario, I'm lucky with that. The other day I received a notice of appointment for a medical appointment that is meant to be high priority, and the date of the appointment was 10 weeks away. Now, I realize in saying that, some people could say, oh, that's really lucky, only waiting 10 weeks, because I know some people in provinces like Quebec can wait up to over a year to get their medical appointments. So I did a little bit of research and I went on the main app that you can use in France to find a specialist. This is for a specialist medical appointment. And for that same specialty, I could get an appointment tomorrow. Now, I might have to pay out of pocket for that appointment and then later on get reimbursed through private insurance if I have it. But the sum of the appointment would maybe be 80 euros. So we're talking 100 Canadian dollars. Here's what I find really difficult. A lot of French doctors are actually willing to come to Canada and wanting to move to Canada to support the healthcare system here. But Canada's healthcare system makes it so difficult to get their license converted to a Canadian license that a lot of doctors and other healthcare professionals move to Canada only to not be able to practice with their license. Let's say you're a doctor, some actually have to work as registered nurses and then wait like 2 to 3 years to get the equivalent of their French medical license. And so I don't understand. Canada is struggling. The healthcare system, especially in a province like Quebec, is really, really struggling. Why are we not making it easier for doctors coming from abroad to help and to get their equivalents? When I see people waiting over a year, or even in my case, waiting 10 weeks, where I see in France, I can see a doctor tomorrow, mind you, in large cities, right? I'm talking Paris, I'm talking other large cities. Something is broken and I want to fix it. I don't know how, but I really want to fix it because it's unfair that the country where you're born, the country where you're from, determines the level of health care you can get. That is unfair. That is not equitable. And I realize I'm like stating the obvious here, but it's this constant reality that I'm faced with in Canada, and it shouldn't be that way. It really shouldn't.
The ways that people like interact with the healthcare system here in America versus Canada where I grew up is so different. Like my family, someone coughed, we would go make an appointment with our PCP. But over here, it seems like a lot of people don't have PCPs. Whenever they're going to the doctor, like, they will wait till they're about to die. Because preventative medicine here is almost like non-existent. Like, a lot of people are so scared. Like, they'll go in for their the annual checkups that they do, where they're like, okay, we're gonna do this screening, everything's free. But then all the tests that you have to do after that are so expensive, and like medications are so expensive. Canada, it's a completely different story. Like, people over there, like, we are so much about care. Like, of course we have like long wait times and a bunch of little things that come with having universal healthcare, but we do not worry about paying a bill the same way people do here.
Yo, Americans online are absolutely losing it. After finding out many Canadians can go to the hospital without getting hit with massive bills, people are comparing healthcare costs, prescription and emergency visits, and the reactions are getting heated fast. Some Americans are asking why are we paying thousands for basic care. Now the internet is debating whether American system is helping people or bankrupting them. Welcome back to my channel. Thanks for sticking with us. If you're new here, do let us know where you're watching us from. Hit that subscribe button and turn on your notifications so you never miss a video. Video credit goes to the original creators for every video used in this episode. Let's get into the video. I'll be back with more commentaries.
I'm an American who just moved to Canada, and I wanted to share a little bit of our experience with the healthcare system here, because I think a lot of Canadians really think that the grass is greener on the other side over in the States, because they think you get faster care, but I want to offer my perspective. One of my sons has been dealing with some health issues for a little while, nothing crazy. We got a referral to a pediatrician. That pediatrician took about a month for us to get into. From that pediatrician, we then got referred into a dietitian. We saw the pediatrician less than a week ago. He had his first dietitian appointment today. They also referred him in to see endocrinology. I got a appointment for him the end of July. For me, this has been a really fast, efficient, well-connected system that I did not anticipate. After hearing people's experiences with the Canadian healthcare system, we started getting him seen back in the States. We started off with a pediatrician, so that's one place where the process is a little faster. You don't have to go family doctor to pediatrician, you just start at the pediatrician. Then referred over to Stanford. It took either 6 or 8 weeks to even get the call from them. They ended up calling us for an appointment the same week we were moving to Canada, so we never moved forward with that. All that to say, referrals to specialists in Canada might be slow. It's just as slow in the US. And there have been people in my comments who have said, I had this specialist I needed to go see. I paid extra to go to the States to go get this done faster. And that's something that is true in the States too. Just like here, you can pay out of pocket to get seen sooner. Just because you have insurance in the States does not mean you can just get seen as quickly as you want, that you don't have to wait for specialists, you don't have to get referrals. You do. I have not found the system here to be any necessarily faster or slower. I just wanted to come on here and offer another perspective because I have lived in both. Honestly, here the benefits outweigh the positives. You will get seen. It takes a while, but that's not to say it doesn't take a while in the States too, because in the States you have to wait for somebody who will work with your insurance, or you can pay to get seen sooner, just like here. Let me know if you have any questions or comments about the American healthcare system versus the Canadian healthcare system and any differences I've noticed. And as always, I will see you on the next one.
How is this possible? I just got back from having a blood test and a routine checkup in Mexico, and it was literally 1,000,000 times better than it could have ever been in Canada. Mexico. It's so sad that as a Canadian, I have to fly down to another country, a way less developed country, to get medical support. It makes no sense. In Mexico, you text them on WhatsApp, the clinic, you walk in, there's nobody there, you get to see a doctor who, my doctor, she was really cool. She's wearing Converse, super cute little Mexican. Go on in, get the blood test, we do a whole routine checkup. I get my results in 6 hours online. No need to wait months to get an appointment like in Canada. No need to wait weeks to get your results. No need to get another doctor's appointment to get your, it's so ridiculous. And so when I hear Canadians say that we have the best medical system, I clearly know that you've never left the country. And when people think that the Canadian medical system is free and that healthcare is free, it hurts. The ignorance hurts so bad. Why do you think that almost half of your paycheck, where do you think that goes? Well, a lot of it is going to, we know, the nefarious agenda, but part of it is going to the super sad, super toxic, super contorted, super corrupted medical system. So no, you are not getting anything for free. And if you have traveled anywhere else in the world, you know that Canada actually has one of the worst healthcare systems in the entire developed world. So there you go. If you have any healthcare needs, any dental needs, any aesthetic needs even, I would say leave Canada and fly down to Mexico, or even better, go to Turkey or Dubai.
Hey guys, I'm back, and today we're going to talk about healthcare. So yes, it is true that Canada does charge a little bit more for taxes, but they have universal healthcare. Oh, but it takes 3 to 6 months to see your doctor, and if you go to the emergency room, you might have to wait there all 8 hours of the day before you're seen. Well, yes, this is true, especially if you're not actively dying, but I mean, this is relatively true for our hospitals. I'm usually takes like an hour, 2 hours to be seen, and then even after that, I'm usually at the hospital for like 4 hours total, and then it takes like 2 months for me to see a doctor. Now, if you have money, you might be able to see a more private doctor that has more time, but you also get better treatment, and you don't have to pay for insurance, and you don't have to pay co-fees, and like it's just so much better. Their life expectancy is better.
At the end of the day, healthcare is one of the biggest issues affecting everyday people. Whether you support American system or think Canada has a better approach, one thing is clear. More people are questioning why medical care costs so much. So what do you think? Should America change its healthcare system or keep it exactly how it is? You might have missed what was said at the beginning. Watch this video again. If you value conversations that go deeper than headlines, hit that like button, subscribe if you haven't already, turn on your notifications so you never miss future discussions. This channel exists because of you. And conversations like this matter because you engage. Thank you for watching. Stay informed, stay compassionate, and most importantly, stay active in the dialogue. I'll see you in the next one. Bye bye.